Welcome back. Now let's dive back in and pick up where we left off from last week's episode. On today's episode of the Forgiven Nutritionist podcast, I had the pleasure to talk with Dr. Eric Balcavage. He is the owner and founder of Rejuvagen, a functional medicine clinic in Pennsylvania. Here's a clip from today's show.
That means you should eat foods as close to the way they walked the earth, came out of the ocean, pulled off the tree, or pulled out of the ground. That's the starting point for everybody. I know in functional medicine, we have these food and diet religion groups, and everybody thinks because they went carnivore and it changed their chemistry that everybody therefore needs to only eat meat, right? And that all other food is bad. We have the paleos fighting the vegans fighting the carnivores fighting the paleos, the pescatarians. Like we've circled the wagons and we're shooting in, right? And meanwhile, the real villain here is the processed food industry who's making all this crappy food. And if we just said, listen, if you eat a healthy whole food diet, the vast majority of the time, you're probably going to be much healthier.
Hey everyone, just a quick break to show some gratitude to our sponsors and give you some special deals. If you are looking for a trustworthy place to choose all of your supplements, FullScript has 285 different brands to choose from. They did the work for you to check quality standards for all the supplements they carry. These standards are important because they help to ensure a product is safe, effective, and accurately labeled. FullScript uses third-party companies to provide unbiased assurance that certain quality criteria are met when they add a company or product to their inventory. When you set up an account with FullScript, use my link and you'll always get 15% off your supplements. Yeah, I'm definitely glad you said that because I think that people, and I'm guilty of this as well. I mean, who isn't? We all want an immediate fix, and I unfortunately think that's why the old adage, a pill for every ill, has taken hold with a lot of people because they think that the one pill is going to help them, and it's because it's going to give the quick fix that they're looking for. But sometimes, like you said, things take time, especially when there's something else that once you get to the root cause, especially if it's trauma, it can take years sometimes. And as long as you are faithful and diligent, it eventually will heal. Because again, like I said before, your body definitely wants to work with you and wants you to get better. And it wants to heal, and it wants to get back to, like you said, that homeostasis place. When I talk with my clients about that, I always think to try to explain to them, it's the good plateau that you want to be on. You don't want to be up here. You don't want to be down here. You want to be right there, and always stay close to that middle line right there. And that's where your body always tries to get you back to, but we sometimes need to help it a little bit.
Yeah, and I think if you add to that, when you talk about supplementation, we assume that when we give a supplement, it's going to do what we want it to.
Right, yeah.
But we have to consider that when we give a supplement, the cells and tissues get to determine what is going to happen to it. Vitamin D is a great example of that. Everybody's being told right now that everybody should be taking vitamin D because everybody's deficient. If you're in inflammatory state, what happens is, one of the things that happens is you become glucose resistant in an inflamed state. Your body says, whoa, there's danger. We're walling off. We're going to make everything more glucose resistant. We're going to push more glucose into the fat cells for storage. So what happens then to vitamin D? Vitamin D also goes to the fat cells, and at the fat cells, what the vitamin D's job is to expand the size of the fat cells to allow more room for storage and try to calm some of the inflammatory cascade and upregulate leptin. And so if you do that, does more vitamin D help what you're trying to help? Does it really suppress the immune system? Maybe not. Maybe what it's doing is really just creating more space for you to store more calories. So people keep eating, they keep storing more calories. More vitamin D has to go there to manage it. More leptin's released, which then starts to cause the brain to not hear those satiety cues, and they keep eating, and it becomes a vicious cycle. Matter of fact, in animal studies, rat studies, when they got rid of the vitamin D receptor, guess what happened when they got rid of the vitamin D receptor in rats? They could not get fat. How about that? So if they couldn't get fat when they didn't have vitamin D, it makes you really question, is the vitamin D really helping my my immune system the way I need it to, or am I actually potentially creating more of a potential problem in the long term?
Right, right.
It would be nice if everything did what we wanted to in the body. I wish it did, but it doesn't.
Isn't that the truth? So maybe you could tell us some key tests. And I know that people get stuck on tests too, so this is kind of a tricky question too. But are there some key tests that people should either make sure that their practitioner runs, at least to give them a good starting point, to make them look or point in the right direction to see what they can do to start treatment? I hate to ask that question because sometimes people get stuck on looking at a number and they think that one number is the end all be all for whatever it is, that like a diagnosis. But are there some good tests that maybe people should make sure that their practitioner asks to find out if they have hypothyroidism or Hashimoto's, maybe to give them, like I said, at least a starting point?
Yeah, and that's all going to depend on what kind of physician you have. So if you have an allopathic physician and you ask for a thyroid panel because you think you have signs and symptoms of hypothyroidism, my hair is thinning, I'm gaining weight for no apparent reason, I'm tired, fatigued, my skin is dry, I'm constipated. If you've got symptoms and you Google hypothyroid signs and symptoms and you got, man, I got a lot of those, maybe I have a thyroid condition, and you go to your primary care physician, they're probably going to run a TSH with reflex to free T4, and as long as those values are normal, they're not going to run anything else, unfortunately. And many times people they do have hypothyroidism. It's not evident in just those two tests, so you need to run a more comprehensive thyroid panel with a total T4 and a total T3 and a free T3 and a reverse T3 and thyroid antibodies to identify the problem. But be aware that a primary care physician and even an endocrinologist is probably not going to run any of those tests because they don't need them for their diagnosis. They're only running a TSH and free T4 to determine when your thyroid gland has been so destroyed that it can't make enough T4, and then their only job is then to give you enough T4 to bring the TSH back into range. So if those are the only things that they're going to potentially run, how are you going to figure out if you have hypothyroidism or Hashimoto's? Well, you could go see a functional medicine practitioner who typically should be running a more comprehensive panel that looks at a whole bunch of your blood chemistry markers, blood sugar markers, liver markers, cholesterol markers, inflammatory markers, a full thyroid panel, a full iron panel. But if you don't have access to a functional medicine practitioner, is there any labs that you could look at on what a regular GP is going to test that might give you an indication that you have some level of tissue hypothyroidism going on? Absolutely. You could look at lipids, elevated cholesterol, LDL, sometimes elevated triglycerides and VLDL are classic indicators that there's a low level of T3 at the liver and potentially at the adrenal gland, so that you're not able to pull the cholesterol out of the bloodstream. It's also a good indication that potentially that person has reduced mitochondria function, and mitochondria are the engines inside your cell that take food energy and convert it into cellular energy, and the mitochondria is T3 dependent. So if I have downregulation of thyroid hormone, this cellular hypothyroidism going on, I'm not going to have super efficient mitochondria. I'm not going to be able to burn fat efficiently, even if you go on a ketogenic diet. And so what's going to happen then is food energy is going to be diverted to cholesterol, and then you don't have enough T3 to either pull it out of the bloodstream into the liver and excrete it, or bring it into a gland, maybe like the adrenal gland, to convert it into adrenal hormones and sex hormones. So it stacks up in the bloodstream. So if somebody says you have high cholesterol, we need to put you on a statin, that should be like a ding, ding, ding. I probably have some level of tissue hypothyroidism going on. The other markers you can take a look at is your fasting glucose, your fasting insulin, and your hemoglobin A1C. If you're fasting glucose, by the way, is like the worst of the markers to take a look at. But even if you're fasting glucose, don't let them just run a fasting glucose. Ask them to run a fasting insulin as well. If you're fasting insulin, and some docs, I like C-peptide, I think it's a better marker, but it's a little bit more expensive, and it's easier to get an allopathic physician, I think, to run a fasting insulin. But if your fasting insulin is above 8 or 10, even if your fasting glucose is normal, you're already headed into glucose or insulin resistance. I don't even like the term insulin resistance because I think insulin gets a bad rap. Insulin's doing its job. It's glucose resistance, which is really going on. The other things you can look at is your GFR, your glomerular filtration rate. And that's an indication of how well your kidneys filter fluids. If you're healthy, you should be in the 100, 120 range for your GFR. If your GFR is under 100, then there's some dysfunction occurring at the renal system, your kidneys, and T3 drives renal function. And I can bore you with all the sciencey stuff, but just trust me, if you have a low T3 state at the kidneys, your GFR is going to go down. Your GFR goes down, your creatinine levels could go up, your BUN levels could go up, and so those would be indications that there's a renal pattern of tissue hypothyroidism going on. For this, one of those markers, creatinine, that's almost always run on a regular chemistry panel. If you see your creatinine is low, even below the lab reference range, that's a good indication that your mitochondria aren't working very good. And again, another indicator of tissue hypothyroidism. There's a whole bunch of other patterns that are going on, and I would always suggest that and we talked about I have these Thyroid Thursday videos. Go watch those Thyroid Thursday videos. I got 9 patterns of hypothyroidism you can find in a regular blood chemistry panel. But you should always be looking to run some inflammatory markers on a blood chemistry panel, because that's the biggest challenge we have is chronic low-grade inflammation. And there's a number of inflammatory markers that you can take a look at. Things like high sensitivity CRP, regular CRP, homocysteine, fibrinogen, higher levels of ferritin, and we can have a discussion about what high is if you want, uric acid, and there's a number of other ones, alkaline phosphatase, low bilirubin levels, all would indicate there's some level of inflammation and oxidative stress. And anytime there's inflammation and oxidative stress going on in the body, you're going to get a downregulation of the conversion of T4 to T3, and you're going to get some level of cellular tissue hypothyroidism. It may not affect everything across the board evenly, but you'll start to see patterns in some of the tissues.
I know you mentioned the CRP level. Do you think that, from what my experience is, do you think that doctors, most traditional allopathic doctors, are actually running that?
I see it infrequently. I think because what they generally consider from their client base is they're overweight, they're getting older, everybody's got some level of inflammation. It doesn't tell us where the inflammation's coming from. So, and what am I going to do about it? I'm not putting everybody on a steroid, so I'm not going to run it.
Yeah. Okay.
Remember, when an allopathic physician, they may want to run all the things that we run in functional medicine, but they are beholden to an insurance company that has set a standard. You might have a great medical physician who would love to run a full thyroid panel, but because of what the standards are of care set by guidelines and insurance companies, if they ran more than what they're supposed to, they're going to get their hands slapped. You may get a big fat bill and you'll be upset because, hey, why did I get charged for this? It should be covered. And the doc's going to be like, look, I tried to run it for you. Insurance company says it's not medically necessary. And we could ask the question, how could any test not be medically necessary? Well, insurance companies pay for tests that there's an actionable treatment or drug that we're going to prescribe for somebody. If your doctor runs a test that there's no drug treatment for, it's probably going to be deemed not medically necessary. But it doesn't mean it's not clinically important, and really clinically important for somebody who's in functional medicine, because lab tests are the things that show up on your lab tests, a high glucose. That is not the problem. That is an indicator of a problem for which we then need to ask questions. Why is the glucose elevated? In allopathic medicine, if your glucose is elevated and you're pre-diabetic, they give you a drug to lower it. It's like playing whack-a-mole like we used to do down the Jersey Shore, right? And so if I hammer this back into range with a drug, I've fixed the problem or I've managed the problem. Well, maybe you've managed it, but you haven't fixed it because you didn't address why that value is out of range to begin with. And you may, by adding adding a drug that they never really maybe needed to begin with, you may have created a whole nother problem to occur. So I think the most important thing is labs is everybody looks at their labs. Or if I'm good if I don't have an H or an L on my lab report. Right. I tell my clients, I tell the clinicians I teach, labs are meant to be interpreted, not read. And what that means is just because there's no H or L doesn't mean that the value is appropriate. So you could have a lab value that's totally normal within the range, but totally inappropriate for the person, right? You could have a lab value that's normal, but totally appropriate. If I feel and function good and all my lab values are normal, that's probably appropriate. But if somebody has the look, the signs, the symptoms of hypothyroidism, their hair's falling out, they're overweight, they're puffy, they say they're constipated, they're tired, fatigued, and their TSH is 1.0, right? And what somebody might say is the optimal range. It is normal, but it's totally inappropriate for the person who's sitting in front of me. So now I have to understand, this doesn't match my client. Why would it be normal? Why would it be in the normal range? And then we have to start looking at the rest of the panel. Do I have inflammatory markers that may suppress this into a normal range, even though it shouldn't be normal? Yeah. Then you could also have a lab value that's abnormal, out of range. But again, it's not the problem. It's an indicator of the problem. And that value might be totally appropriate for the patient who's sitting in front of me. So, hey, this person has a high TSH. They have hypothyroid signs and symptoms. That's totally appropriate. Somebody might say, I'll just give them thyroid hormone. Those of us in the functional medicine space who practice functional medicine would say, okay, maybe they need some thyroid medication temporarily, but really what we need to do is figure out why that gland's not making appropriate thyroid hormone.
Yeah. Well, and maybe you could tell us a little bit why you titled your book The Thyroid Debacle, because some of what you just touched on, I think, may be covered in why you titled it that.
Yeah, I think I titled it that because I thought what was going on in functional medicine was a mess. And early on, when you have your own healthcare issues and don't get the satisfaction in allopathic medicine, then you come to functional medicine, you're like angry initially. Like, why do they do this? Why are they missing it? Why are they not doing that? And that was really the reason I initially came up with the title, The Thyroid Debacle. Like, this is a mess. And then I thought about how a lot of people in integrative and functional medicine are dealing with it. They're saying, oh, those medical doctors are bad. They only give T4. We're going to be better. We're going to give T4 and T3, or I'm just going to give T3 and just high dose T3, and thinking that was better. And I'm like, man, that's a mess too. That's not the way that we fix this thing. So that's where the name came from, is that, hey, I think we have to have a whole new reset in how we're looking at physiology. We shouldn't be giving the allopathic physicians a hard time for doing what they do. It's what their training is that allows us in functional medicine to have a space. Here's what they do: acute care, disease management. If you don't want to change your diet and lifestyle, go to allopathic medicine. But if you don't want to take a lot of drugs, you do want to identify root cause issues, then that's what our job is. It's different from what your allopathic physician is. So I had Kelly and I both had. Kelly's a medical physician who had her own health issues and came into functional medicine, and we both had that kind of angry kind of mode going when we initially started writing the book. But then once we read through, and some people said, "Man, you guys sound angry." We were angry, but then we realized, hey, this is what we need to really do. Is build the bridge, and we have to realize that there's really good medical physicians. They're great at acute care. They're great at management for people who don't want to put the work in, but we also have to have another option, and we're not going to build the bridge where allopathic physicians are going to go, hey, that's not what I do, but go see this functional medicine practitioner and they can help you address the root issues. It's just not what we do here. And if we build the bridge, then we can give people the best of both worlds. There's allopathic medicine for when you need it, and then when there's not an acute crisis and you're trying to get healthy, then you come to functional medicine, and we can work together as a team versus two professions banging their heads against each other, and all not great things for the client who's trying to get better. We don't want the clash of egos. Everything should be focused around our clients and helping them get better any way possible.
Oh, definitely. 100% agree with that. Yeah. And I find it comical and awesome all at the same time. The Thyroid Debacle title. It's well said, because I think just with medicine in general, like you said, there's definitely a clash, and there's definitely seems to be a great divide between the two worlds sometimes. And I also forget that that sometimes regular allopathic doctors, their hands are tied because of whatever system they're part of, around here at least too, there's not a lot of just a typical family practice doctor where he's off on his own. They're always connected to a chain of hospitals and a giant network. So their hands definitely are tied more than if he were on his own, or she were on her own, whoever it is, because they get to choose and decide what they can or can't do more often than not. But yeah, when you're tied to large companies and corporations and hospitals, I also forget that their hands, like you said, are tied. They're only supposed to do certain things, and
I think if we do our job in functional medicine, educate our clients, not bash their medical doctors, and make them aware that this is what they do. Unfortunately, it's the job, and the role they've been pinholed into. So we have to get away from beating up the medical physician and just help educate our clients that, hey, this is just what they do. They're not going to run those tests. It's not what they're allowed to do. They don't know what to do with those results when they get them. But if we build the bridge, then they're going to be more likely to say, yeah, it's not what I do, but go see this person. I just had a client who was diagnosed with thyroid cancer, I think about 6 months ago, and it was about 2 months before I met him. And we've been working together for probably the past 4 months, and he just had his follow-up with his cancer doc, and they did a new scan, and his doctor's like, what the heck has been going on here? His one side of his gland is perfect, and the other one has almost no inflammation in it anymore. And he's like, I don't know. He's just not used to. He's not seeing this stuff like on a daily basis. And he explained to him, hey, what I'm doing. He goes, I don't know what it is you're doing, but just keep doing it, right? And so it may not be, hey, let me learn, what you're doing. That would be the best thing, right? But at least it wasn't, oh, you need to stop doing that because I don't know what it is. It was, hey, whatever you're doing is working. Keep doing what you're doing. And what are we doing? We're working on diet. We're looking on lifestyles. We are using supplements, but we're using them strategically. Short term, use them, get them out of there. But the whole time, we still have to work on his sleep, his breathing, his diet, his nutrition, his physical fitness. And those are the things that are going to provide the long-term solution, not the supplementation.
Right. And what about thyroid medication? What do you think about medication for thyroid? And I would like to hear your thoughts because I'm not opposed to medication as in general, but I am definitely opposed to when clients or patients do not get the full information about what those medications can possibly do or not do in their body. And I think that people just take the pill or get the pill or the prescription and they don't ask questions. And the doctors don't tell them, okay, here are some side effects that could go along with it. Or here's what can happen if you do take them, especially long term. They just assume that they can just keep taking things and taking things and taking things for decades sometimes.
So the primary thyroid medication that's prescribed in an allopathic or traditional medical world is just a T4, and it could be levothyroxine, Synthroid. There's a number of different T4-based medications, and that's the primary tool in allopathic medicine. And if somebody is woefully deficient in thyroid hormone, their gland's been that damaged, and by the way, by the time most people get a diagnosis of hypothyroidism, they've lost 90% of the function of the gland. That's in the literature. Okay, so it's not the beginning of a thyroid condition, it's the end. So they may need some thyroid medication initially. The problem is if doctors are only looking at 2 markers, and sometimes doctors think that because there's thyroiditis, they're going to suppress TSH. They're going to give them so much T4 that it drives their TSH really low. And TSH, for the listener, is the hormone that's made by your pituitary gland that's telling your thyroid gland to make more hormone. And so physicians have been taught that if they suppress TSH and give so much thyroid hormone medication that it drives their TSH really low, there won't be any stimulation to the thyroid gland. That way, therefore, there'll be less inflammation to the gland, and they can just survive on the T4. The problem occurs with that is if you drive to a TSH too low and you take too much T4, it actually reduces the conversion of T4 to T3, the active hormone. So initially, the thyroid hormone may feel good, because if you don't have any or have very much and you get some, you're going to feel better. But then you're going to hit the plateau, is what I call it. And if you're into smoking meat, you call it the stall, right? So everything just stalls and it just stops. And so then you start to complain like, hey, I don't feel so good. And your doctor says, hey, I'm going to give you more and give you more and give you more to suppress the TSH or try to suppress your symptoms. And what they don't realize is they go higher and higher with the T4 dose. They're actually making the conversion of T4 to T3 in the peripheral tissues worse. So they're actually making their hypothyroid patients more hypothyroid in the periphery, but they're actually creating more hyperthyroidism in the brain. And so you'll get more brain fog, more insomnia, more high histamine type symptoms, because excessive thyroid hormone is also causes mast cells to degranulate. So you get a lot of brain fog, hyperactivity, heart palpitations, all these other symptoms. So we can't just, medicate and forget, or medicate and just don't worry about it. But the allopathic model has been trained that the more they give, they can't really create too much harm, because, it's just, if they don't need it, they'll get rid of it, right? But they can trigger too often. A little bit's going to be good, and then you're going to hit the stall, and then you're going to start to reverse, where you'll get more hypothyroid symptoms peripherally and more hyperthyroid symptoms in the brain. And they'll say you can't have those. That's just not the way it works. But yeah, absolutely, it'll occur. That has led to, in functional or integrative medicine, people saying, well, when I look at your labs, your doctor didn't look at T3 and free T3 and reverse T3. And now that I'm looking at those values, I can see that your T4 is high, your reverse T3 is high, and your free T3 is low, and your T3 is low. And therefore, you're not converting T4 to T3. And what integrative and functional medicine, in my opinion, has made the mistake is that they're saying, oh, you've lost the ability to convert T4 to T3, and you're over converting it to reverse T3, and the reverse T3 is blocking the T3 that you do have from working, and none of that is actually true. And so they say their model is, well, we're going to give both T4 and T3, and that'll make you feel better. And guess what? Initially it will, because now you're getting some T3 that you didn't have before, but in time the same thing happens. You'll take that T3, you'll feel better, you'll hit the stall, you'll complain, they'll give you more T3, you'll feel better, you'll hit the stall, then they'll give you more T3, and you wind up titering up the T3 just like you did the T4. And guess what? You're going to have the same issues. You're going to have more hyperthyroidism in the brain, more hypothyroidism in the tissue. The functional medicine practitioners get frustrated, integrative practitioners, and they're like, they're looking at your blood values right after you took your hormone and saying, hey, everything is great, I can see it. But what they're looking at is what's in the bloodstream and not what's going on in the cell. You can provide some temporary benefit, but you're not going to fix the underlying issue. And if the cells didn't want the T4 that the body was making naturally, and it was trying to get rid of T3, why would forcing more T3 into the system be the right strategy? To me, it's just asinine. Now, do I disagree with anybody taking a combination of T4 and T3? No. If you feel awesome on some T4 and T3, great. I don't care what you take. If you feel great on high dose T3, awesome. That's awesome. But I don't think, if the goal of the client is to just take a pill and forget they have to do anything else, take whatever makes you feel good. If your goal is to say, I want to address the root cause so I don't have to take thyroid hormone medication forever, so that I can get my thyroid gland to start to function again, adding T4 and T3 and just keep ratcheting up those numbers, trying to play whack-a-mole with those numbers with your meds is not going to help you get to where you want to get to, okay? So I think whatever somebody takes that makes them feel good is probably what they need. But be careful. If you take something and you start eating stronger and stronger doses of it, it's the wrong strategy, and you're not addressing what you really need to do. And you're going to wind up, I think I did a post somewhere, are we creating T3 addicts? Because that's what walks into my practice a lot now, is the people who are taking higher and higher doses of T3 because other thyroid experts are recommending that and thinking that that's the right strategy. And initially they feel good, and then they're on high doses, and then when they try and reduce it, they feel awful because we've kind of given them the fix, and then we're pulling the rug out from them if we try and reduce it, because now we've suppressed their thyroid gland so badly that it can't even generate and convert. So I think it's a terrible strategy for the long run.
The other thing I was grateful that you brought up was hyperthyroidism, because I know I haven't touched on that or I said anything about that, but I do actually know somebody who has hyperthyroidism, and it's not something that you ever really hear anything about. And so just when you were going through some of those symptoms, I'm like, yep. I checked all the boxes for what this person experiences on the regular. And so do you think that hyperthyroidism is, from what I'm aware of, I don't ever hear anybody talk about hyperthyroidism. I only hear about hypothyroidism and Hashimoto's. So what do you think, like, why is the hyperthyroidism not as prevalent? Or is it just in my area that my circle of people and the clients that I know of?
I think, I get a lot of patients that are diagnosed with hyperthyroidism, but the vast majority of patients the vast majority of those patients that have hyperthyroidism have already had their thyroid gland irradiated. They've already had it removed. So we're not getting the true hyperthyroid client. We're getting the patient who's already been treated, had their thyroid gland destroyed, and now they're on thyroid hormone replacement therapy and still feel awful because of the same mechanisms. Hyperthyroidism, hypothyroidism, they're both immune-driven disorders. Okay, so the underlying, everybody said, I get the comment on my stuff like, talk more about hyperthyroid, talk more about it. It doesn't matter what the name is. They're both immune-driven disorders. Okay, so at the end of the day, we have to do the same things whether you're hypo or hyper. They're both immune-driven disorders. Now, if you've had your thyroid gland removed or destroyed and you're on hypothyroid medication, you still have an immune-driven disorder, but now you have the issue that you're having is the same issue that all the patients diagnosed with hypothyroidism have, is that even though you're loading the bloodstream with thyroid hormone, it's not getting into the cells and tissues and working the way we want it, and that's why you're symptomatic. So the strategy after treatment, standard medical treatment, is exactly the same still. Now, if you're in an active hyperthyroid state and you still have the gland, then one of the things that we need to do, not only look for the root issues, is we also need to make sure that we're calming down that hyperthyroidism. And sometimes people use medications to do that, but you can also use other things like carnitine, which will help suppress that hyperactivity. But how you do it and how you choose to do it, you definitely should be working with a physician, whether it's a medical physician to kind of manage that hyperthyroidism, or if you're working with something like with some carnitine or other strategies, you want to work with a functional medicine practitioner who knows what they're doing and can help you understand how to monitor that process so you don't get yourself in danger, because a true hyperthyroid state can be very, very dangerous for somebody, and we don't want to see that.
Yeah. Unfortunately, the one individual that I'm thinking of, they're not at a state in their life where they're happy where they are. I will just say they're happy with where they are, which is unfortunate to me, because I know how, like I said before, the body can heal and the body can do amazing things, and the body wants to get better. But I can only help somebody who wants help, right. And I can only do so much.
Yeah, we're just Sherpas, right? That's what I tell my clients. I'm your Sherpa, right? I will help you get up to the top of the mountain. I might carry you for a part of it, but if you're kicking me in the shins all the way up, I got to drop you, right? Yeah. So the issue is we can help, but you've got to do, a lot of this is work that you have to do. And for a lot of people, their mindset is a huge component of why they have health issues. If you're not willing to change what's going on between the 6 inches of your ears, you're probably not going to get well or stay well for very long, because people revert right back to the same habits, the same behaviors that created the problem many times, or they didn't address the underlying conscious or subconscious stress or traumas that they've had. And so the environment only changed temporarily when we changed the diet. It only changed temporarily when we provided a supplement. But once those things are gone, they're back to the same environment. And why wouldn't you expect the same problems to come back? But I know one of the things that you kind of mentioned before was the percentage of people that have hypothyroidism. And I would make an argument that even though the statistics say it's like somewhere between 6 to maybe 10% of the population, I would say that those numbers are woefully deficient. That may be glandular exhaustion, but that is not cellular or tissue hypothyroidism. If greater than 50% of the US population is overweight or obese and has elevated cholesterol, metabolic syndrome, all of those people, I would argue, have a level of cellular or tissue hypothyroidism going on. All of them.
Yeah.
And so I think the incidence of hypothyroidism, whether you want to call it glandular, subclinical, or tissue hypothyroidism, which is what I speak about, it's probably 60 to 70% of the population to match the level of overweight and obesity and diabetes that we have. That's how bad it is. But we're not going to fix it with medication.
Yeah, no, definitely.
We're going to fix it. We're going to fix it with diet and lifestyle and behavioral changes. That's how we fix it long term. Otherwise, it's just going to get worse and worse and worse. You're going to see more and more people being diagnosed. And it's going to be, and if you think about it, the thyroid medication has always been, for the last 2 to 3 decades, has been the number 1 to number 3 medication prescribed.
Yeah. Yeah. Well, literally almost everybody I know, especially women, like I would say at least 90% of the women that I know are on some type of thyroid medication for one issue or another. And I think that's a good segue into you kind of telling us what multi-system adaptive disorder is.
Yeah, so that was a good segue for you to get into that. So what is that? So when you talked before, like, people want to know what it is I have. They want something to hang their hat on. Like, what do I have though, doc? Right? Do I have fibromyalgia? Do I have hypothyroidism? Right? And so I hate labels. But people would say, well, what's wrong with me? Do I have an adrenal issue? Do I have this? Do I have that? And if you've been doing this work for a period of time, rarely does anybody have one thing going on, right? Anytime and for the listener, remember, cells, if they're in low stress, they're in manufacturing mode. They're trying to bring as much glucose, as much fuel into the cell to make as much stuff as they can, right? It's like a widget factory. I want to make as many widgets as I can and just pump it out. But if the cells are perceiving stress or threat, they're going to slow down the metabolism, stiffen the cell membranes. They're going to reduce glucose coming in. You're going to see a whole bunch of systems start to become compromised. We're shutting down normal manufacturing, and those people in the widget factory, they're no longer making widgets. They're trying to put out a fire, right? So no widgets are being made. All the attention, some people are running out of the place. The other people are spraying the whole place down with foam or water, whatever. The whole focus changes. So the same thing happens in our physiology. If my cells are feeling a threat, whether it's bacteria or virus or a toxin or whatever it is, you're going to start to see multiple systems start to become downregulated. You should expect that your renal function is going to start to become downregulated. You should expect your glucose. You're going to start to become glucose resistant. You're going to start to have problems with your hormone regulation. You should expect to see your cortisol regulation starts to become compromised. You should expect that almost every system in the body is going to start to have to make adaptive changes, and you're going to see multiple systems start to become dysfunctional. That's not broken physiology, at least at the onset. That's the adaptive change. So when somebody says to me, what's wrong with me? Do I have hypothyroidism? I'm like, listen, you have excessive cell stress that's causing multiple systems to have to adapt to whatever those stressors are. So if you want something to call it, you have a multi-system adaptive disorder. And I like that term better. I hate labels, but I like the term because that is different than you have this disorder, that disorder, this disorder, like things are broken. Right? You have adrenal fatigue syndrome, which technically doesn't occur, that sounds terrible. Like, how am I ever going to recover from that? But if you say, hey, I have a multi-system adaptive disorder, that means I'm adapting to something. If I remove that something, I should be able to go right back again, right? Yeah. And when that's what you and I see in our clients, if we're really doing functional medicine and you change their diet and you get rid of processed food, they go, wow, my belly feels better, my gas, my bloating is better, right? Hey, we're going to work on your sleep habits, your sleep behaviors, and your breathing. And hey, now I wake up, I'm not tired, I'm not fatigued, right? So as we start to reduce the stressors, they can revert back to normal physiology. So I had to come up with that term just because people kept trying to hang their hat on some disease or disorder, like, well, I have it because I have fibro. Well, no, we made up that name. It's just a clump of symptoms put together. If it makes you feel good, great. But the worst thing with identifying with a disorder is you become comfortable with that disorder. Yeah. That uncomfortable comfortableness, you start to behave the way somebody who has chronic illness behaves, right? And so I have my friend group who all have fibromyalgia. I want to stay friendly with them. So you're probably less likely to do the things that you need to do to get yourself better, because now you're going to leave your group. So I hate the labels, but I had to come up with something to help people understand all of this other stuff. Because they go, well, I need to go to a gastro person. I need to go to, because I got IBS or SIBO, and I got to go see an adrenal person. I got to go see a sex hormone specialist. No, you don't. All we need to do is we need to identify what's creating excessive cell stress. As a functional medicine practitioner, I'm really good at all those other systems. You don't need to go see a whole bunch of different specialists. You really just need to focus on what's creating the excessive cell stress. And as we fix those things, reduce and eliminate the stressors and support the recovery through habit changes, dietary changes, and some strategic supplemental strategies, the systems will start to come back online.
Well, and that was going to be what I was going to ask you next. What is the strategic thyroid solution that you talk about in your book? Because there's it's
exactly what I really talk about is, first of all, we need to identify what's going on with that individual. When we look at their good comprehensive health history, their health timeline, their signs and symptoms, and a comprehensive metabolic panel, like what is going on with this person, then we need to decide, do they have an immune inflammatory issue? Do we have this multi-system adaptive disorder going on? What systems are in adaptive mode? Have any of those systems really started to break down? And then we need to consider what's creating this excessive stress response. We got to go through all these different systems to identify where they're the weakest. We got to start to reduce or eliminate those stressors and then support that recovery back to health. I think a lot of times people want it to be like a snap. Hey, I got rid of the bacteria, I should be better now, right? No, it's still going to take time for your body to heal and recover. It's been 20 years since you've been ill, right? Or, hey, I want my thyroid gland to recover tomorrow. No, it takes about 8 years for a thyroid gland to start to turn over. So it's going to take some time. It may not take 8 years, but it's still going to take time. So we've got to support the recovery of the tissues. And then long term, you've got to have really good habits the vast majority of the time. I don't think anybody needs to have a perfect life. If you want to try, that's great, but I think it's too stressful for a lot of people. But you have to have really good habits 80% of the time, and then you can have some bad behaviors occasionally. And that's, I think, the true success to a healthy, happy life. Because I think it's overwhelming for everybody to say, I'm going to do everything perfectly. And it's just not going to work.
Well, and that's a good question for me to ask you then too, because let's take nutrition or diet, for example, as one of those things, because you did mention how important sleep was as well before. But as far as diet, are there some non-negotiables that you would recommend for most people to either non-negotiable, you need to add these into your diet on the regular, or a non-negotiable, do you need to take these out of your diet if you really want to help your thyroid?
Yeah, I think it's pretty easy. The easy answer is you need 80% or more of the time you need to be eating a healthy whole food diet. What does that mean? That means you should eat foods as close to the way they walked the earth, came out of the ocean, pulled off the tree, or pulled out of the ground. That's the starting point for everybody. I know in functional medicine we have these food and diet religion groups, and everybody thinks because they went carnivore and it changed their chemistry that everybody therefore needs to only eat meat, right? And that all other food is bad. We have the paleos fighting the vegans fighting the carnivores fighting the paleos, the pescatarians. Like we've circled the wagons and we're shooting in, right? And meanwhile, the real villain here is the processed food industry who's making all this crappy food. And if we just said, listen, if you eat a healthy whole food diet, the vast majority of the time, you're probably going to be much healthier. Forget the argument, organic, non-organic for starters. Just start with, I'm going to eat a healthy whole food diet 80+% of the time. Mm-hmm. That's my non-negotiable. If you want to try and get healthy and you're not doing that, there's no way you're going to get healthy. If you want to have the argument about organic or not organic, I'll have that discussion with you. But having that discussion too early stops people right off the bat. Well, if I can't eat organic, I'll just eat whatever I want, right? Mm-hmm. Just get rid of the processed food. That's the easy thing, right? Just start eliminating the processed food. And don't think about what you're restricting. Start looking at all these healthy whole foods that you've never eaten before. Mm-hmm. And look at all the opportunity that's out there. That's my hard line in the sand. And don't listen to all the diet guru stuff that's out there. All of that stuff is made up. And yes, eating carnivore for a while, could it change your gut physiology and change your symptoms? Absolutely. Is it a great long-term strategy? Probably not. But it might be a good temporary strategy. I've used it with clients who were struggling and said, hey, let's try this, see how it works. Oh my gosh, I feel so much better. Great. But then we need to get back to a diverse whole food diet. Why? Because we need a diverse gut biome, and you get a diverse gut biome by having diverse whole food as the staple.
Yeah, definitely. It's pretty much what I try the best I can with my clients. There are some who are a little more difficult in changing they get stuck, and I can empathize because for most of my adult life, I started my day with a 32-ounce Coke from a certain restaurant. And, mm-hmm. So I was literally and physically and emotionally addicted to mm-hmm. that 32-ounce Coke, and so I get the struggle with breaking up with some food items. So I understand that. But yeah, I try the best I can to get them to go back to basics. Like you said, if it walked the earth, if it came out of the ground, you can pick it off a tree. Great. If it grew on a plant or eats a plant, go for it. But if it was made in a plant, think twice about it. Yeah.
And we all get, right, that, hey, this food tastes good. There are really well-paid people making these foods so they taste good, so we think they're nutritious, but they're not really, right? And so we all have that, and they're made so that we crave them and we want more. I mean, that's how the food industry makes all the money, right? Is by saying, not by making the thing that tastes the best, but by the thing that makes you eat more of them. I mean, I forget what book it was, but they talked about the Oreo cookie company, right? I think you probably read that story. The guy said, what recipe they use? You use the one where they eat the most, or the one that they said they like the best. I'm like, no, we don't use the one that they say they like the best. We use the one where they ate the most cookies. That's the recipe we use. Even if they didn't like the flavor, the one they ate the most of, that's the recipe we go with. Because they make money by getting you to eat more stuff. What's ironic, right? Like, you could eat a whole bag of, what are those things that, cheese curls, right? Oh. Those things are made so that you could eat that whole bag. They go in your mouth, they dissolve into nothingness, and you still you crave more and crave more. You can eat the whole bag, you don't get full, you could eat another whole bag. Mm-hmm. How many apples could you eat? Yeah. Like, realistically, right? Because an apple as a whole food, you eat one apple, you're like, I'm good. One banana, I'm good. Because everything you need is in there and it satisfies you. But we don't overeat bananas and apples typically. We overeat processed food. And it's not by accident that occurs. There's a whole industry that's trying to get you to do that.
So as we wrap up, I always like to ask my guests what their don't miss this moment was for today's conversation. So what would your don't miss this moment be if you want my listener to take one thing away? What would that be?
I think the one the takeaway moment from this conversation, I only get one?
You can pick two.
All right. So number one is I want you to understand that you don't need to be satisfied with where you're at if you're not healthy and not well. Mm-hmm. And I think you're the person that said, hey, we got to start asking better questions. If you don't feel well, don't function well, you got to make it your priority to be your own advocate, to say, hey, something's going on here, and understand that your medical physician is doing their job, but they don't do our job. Our job is to actually identify what's causing your unhealthiness, and identify it, address it, eliminate it, and get you back to health. Your allopathic physician, their primary job is to diagnose disease and manage that disease. And so if you don't get the satisfaction you want from your primary care physician, look for a functional medicine practitioner to work with. It's rare that I talk to somebody after doing a functional medicine process and they go, yeah, I think I'm going to go back to allopathic care. It just doesn't happen. The other thing I want you to be aware of that is almost everything that you need to do to improve your health and well-being, you can do.
Yes.
They're all simple things. They're not all easy to make changes, but they're all simple things to do. Your diet, your lifestyle, your thoughts, your behaviors, your habits have created who you are today. If you want to change, something in there needs to change, and there's layers to what's going on. I think there was a famous philosopher, his name was Donkey, I believe, and he was walking through the field with this guy named Shrek. And Donkey says to Shrek, ogres are like onions, right? You got to peel back the layers. And health conditions and health problems are like onions. As we start to work on them, we have to peel back the layers. Most people think that their health conditions started when they got diagnosed. And for the vast majority of us, our health conditions started 10, 15, 20 years ago. And one of the things that I'm sure you do, I do, is we make our clients write out a health timeline. And when you read somebody's health timeline, it's like super easy to start to figure out how we got here, because you just look at the accumulating load of stress over time and you go, yeah, this is destiny to be here. So how do we fix it? We got to reverse engineer how you got here. And almost all of it involves modification, diet, and lifestyle. Supplementation, great tool. Functional testing, great tool. But if you're not going to make some changes, habit, lifestyle, behavior, thinking, mindset, you can't expect it to supplement. There's not enough supplements to get you well.
That was the perfect way to end our conversation today. But before we go, why don't you tell the listener where they can find you, follow you, watch your Thyroid Thursday videos, or even get your Thyroid Debacle book?
Yeah, so the Thyroid Debacle book is available, I guess Amazon is where the most, Barnes & Noble, Amazon, I guess where you buy your books. Look for the Thyroid Debacle. You can even, if you want an autographed copy, reach out to me and we can send you an autographed copy. We can ship it to you directly. My website is rejuvagencenter.com. I have a podcast called the Thyroid Answers Podcast, and even though it's entitled the Thyroid Answers Podcast, I know you've started to listen to a few episodes. Everything centers around this whole concept of the cell danger response, and I'm either in homeostasis or allostasis. Doesn't matter what condition you have. I think we do a pretty good job of not being too fluff, and not going sometimes too deep. I do have a tendency to go sometimes deep, but I think we provide information. Doesn't matter if you have a thyroid condition or not. I think you can get a lot of valuable information from me, Dr. Kelly, and the guests that we have on the podcast. I also have, I'm on Instagram. I think it's Dr. Eric Balcavage. I think that's what it is, where I have regular posts, videos, and then I'm on YouTube, where you can find the podcast. You can find my Thyroid Thursday videos there, and linked to on Instagram, where I pick up topic. Somebody usually is sending me, can you explain vitamin D? Can you explain why my T3 is low? And I'll do a longer, about 10-minute discussion on a topic, and that's what the Thyroid Thursdays are.
And I'll put a bunch of links in the show notes too for people who are not able to write anything down or Google you right now. I'll put some links so they can just click on those and find you too. So thank you so much for being on today. I very much appreciate it and enjoyed the conversation today.
Yeah, absolutely. I appreciated being on. It was a great conversation.
Are you looking for a good probiotic? Seed DS1 Daily Synbiotic has both prebiotic and probiotic. It supports digestive health, heart health, skin health, and gut health, including those who suffer with IBS. Their products are clinically studied and third-party tested for quality, and I think you'll be impressed with their eco-friendly packaging. Click the link in the show notes and use my code FORGIVEN for 15% off your first month's supply. If you want to continue learning and hearing all things nutrition for your mind, body, and spirit, click like, subscribe, or favorite me on whatever podcast platform you use. Or you can find me at ForgivenNutritionist.com. This podcast was designed to educate, inspire, and empower you to achieve your health and wellness goals with your current healthcare provider. It is not meant to diagnose or treat any illness or medical condition or take the place of any treatments from your current healthcare providers.